Somebody call down to transport and tell them their girl wandered into the wrong meeting, Dr. Roland Ballard said, not bothering to look up from his folder. We're discussing patient outcomes in here, not lunch trays. A few people at the long table laughed the way. People laugh when the most powerful man in the room makes a joke. Ballard had been chief medical officer of Calderwood Regional for 19 years and a practicing cardiothoracic surgeon for 31 before that, and when he made a joke, the room laughed. He adjusted the cuff of a shirt that cost more than the woman in the doorway made in 2 weeks. The woman in the doorway did not move. Nia Brevard was 26 years old, in a gray blazer she had bought that morning at the Goodwill, on Route 9, and pressed flat on an ironing board that wobbled. She had a manila folder of her own under her arm. Behind her, in a wheelchair she had pushed herself, sat Odessa Brevard, 79, the woman who had raised her, in a Sunday dress the color of a robin's egg, holding a brass mining tag in her closed fist. My grandmother has a name on the agenda, Nia said. Item 6. Brevard, Odessa. Grievance hearing. We're on time. Item 6, Ballard repeated, like the words tasted wrong. He glanced at the chairman beside him. Howell, did we put a transport aide on the agenda? To understand what was about to happen in that boardroom, on the 4th floor of Calderwood Regional Medical Center, you have to go back 3 weeks, to a kitchen on the dead-end stretch of Cobalt Street, in Merrifield, Ohio, where a young woman was already awake at 4:30 in the morning, reading a denial letter for the 90th time. The kitchen had belonged to her great-grandfather. The whole house had. Amos Brevard built it in 1954, with money he'd clawed out of a coal company that spent 30 years trying not to pay him. And the table Nia sat at was the table he'd built too, and the Bible on the counter, with the yellowed newspaper clipping folded inside it, was his. Nia didn't read the clipping that morning. She knew it by heart. She had known it by heart since she was 10. Odessa Brevard had served hot lunches at Merrifield Elementary for 38 years. She knew every child in that town by the way they held their tray. When her daughter and son-in-law died on the wet curve of Route 9, the same road where Nia bought the blazer she came home from the funeral with a 4-year-old granddaughter and a diaper bag and started her whole life over at 60. By 6, Nia could read a newspaper out loud. By 12, she was correcting the pharmacist on her grandmother's prescriptions. She didn't go to a fancy school. There wasn't one to go to. She went to Merrifield High, and then to 2 years of community college at night while she worked days. And somewhere in there, she found medical coding the way some people find God, all at once and for keeps. She passed the certified professional coder exam on the first try, top of the testing center, a perfect score on the auditing module. She applied to 41 billing and coding positions in 3 counties. She got 2 interviews. Both times a man behind a desk looked at her resume, then looked at her, then explained that they were really looking for someone with a 4-year degree. Someone with hospital experience. Someone was the word nobody said, like the people who already worked there. So Nia took the only job at Calderwood Regional that would have her. She pushed beds. She wheeled the dying down to imaging and the newborns up to the nursery. And at night she went home and audited charts. Nobody was paying her to audit, because she could not help it, because a wrong code was a lie, and a lie made her itch. The trouble started in March. Odessa's heart had been failing slowly for 2 years, a stiff valve, the cardiologist said, a thing they could fix now with a catheter, where once they'd have cracked her chest. The procedure had a name, transcatheter aortic valve replacement, and it had a clear recommendation from Odessa's own cardiologist, Dr. Bridget Tomczak, who had put it in writing twice. And then, 11 days before it was scheduled, a letter came. The procedure was denied. Not medically necessary. Conservative management recommended. The letter came from Stonebridge Health Partners, the company that ran utilization review for Calderwood, the company that decided who got cut open and who got sent home with a pamphlet. Odessa folded the letter and put it in the drawer with the rubber bands and said the Lord would provide. Nia took the letter out of the drawer that night and read it under the lamp, and felt the old itch, the wrong code itch, crawl up the back of her neck. She started with the things she could check for free. The letter said the denial had been reviewed by a physician, as the law required, a peer reviewer who had examined the chart and agreed the surgery wasn't warranted. The reviewer was named at the bottom in small gray type, Dr. Ambrose Heald. Nia typed the name into the State Medical Board's public license lookup, the same database anyone with a phone can reach, and sat very still in her great-grandfather's chair. Dr. Ambrose Heald's license had a status. The status was a date, and the date was a death. Ambrose Heald had died of a stroke in a hospice in Sandusky 5 months before he supposedly sat down and reviewed Odessa Brevard's heart and decided she could live without a working valve. Naya did not sleep the rest of that night. By morning she had filed a grievance, the formal kind, the kind hospitals hate, and used the patient advocate phone number printed on the back of every Calderwood badge, including her own. A woman in the grievance office named Verna Loomis took the call. Verna Loomis had worked in health information management at Calderwood for 31 years. She was the woman who knew where every chart lived, who could find a record from 1998 in under a minute, who had watched the place go from a county hospital with a quilt in the lobby to a thing owned by a company. When Naya said the words, "The reviewer was already dead," there was a long silence on the line. Then Verna Loomis said, in a careful, quiet voice, "Come see me. Use the side door, not the lobby." And before she hung up, she said one more thing. "Bring everything you've got. And honey, don't tell anybody you talked to me yet." Calderwood's grievance process gave Naya a preliminary session first, a kind of screening before the real hearing, and that was the room she walked into 3 weeks later, the room where Ballard told her to go find her lunch trays. It did not go better than the kitchen had promised. Chairman Howell Driscoll, an insurance executive who sat on the board because his family name was on the cardiac wing, pronounced Brevard wrong 3 times. The first time was fast and could have been an accident. The second time he stretched it out. The third time he smiled while he did it, and Naya understood that he had read the file, had seen the name in print, and was choosing this. Ballard turned his chair a few degrees so his shoulder faced her. A young administrator with a tablet kept glancing at her blazer and then at her shoes, which were the only good shoes she owned, scuffed at the toe. "Mrs. Brevard," Driscoll said, "I'll be candid. This grievance is, frankly, a misunderstanding of a complex clinical process. Coverage determinations are made by physicians. You are, what is it?" He looked at the tablet, "Patient transport. I'm sure you're very good at it, but you're not equipped to second-guess board-certified specialists." He let that sit. "Don't you have beds that need turning?" Behind Naya, somebody in the row of administrators chuckled. Odessa lowered her head and did not raise it again. Naya did not flinch. She had practiced not flinching in the bathroom mirror for an hour the night before, dropping her shoulders, keeping her hands open on the table instead of fisted. "Item 6 is a grievance about a denied procedure," she said. "The denial states it was reviewed by a physician. I'd like the board to confirm, for the record, that proper physician review took place." "It did," Ballard said, bored to the ceiling. "Our review process is rigorous. Every adverse determination is examined by a licensed physician. Every single one. Now, if there's nothing else," Nya said, "but I'll wait for the full hearing." That made Ballard look at her for the first time. It was a short look, the kind you give a fly that won't leave. Then he went back to his folder. Driscoll scheduled the full hearing for the following week, a Thursday, and told her to bring an actual physician's letter if she wanted to be taken seriously. And the young administrator opened the door for them with a little flourish that was its own kind of insult. In the hall, while Naya was turning the wheelchair, a man from Stonebridge's table came past with a paper cup and let his elbow swing wide so the lid popped, and coffee went down the front of Naya's gray Goodwill blazer, soaked the cuff, ran onto the manila folder on Odessa's lap. "Whoops," the man said, not slowing down. "You'll want to get that dry cleaned." Ballard, by the elevator, laughed without turning around. Nia did not look up. She took a paper towel from her bag and blotted the folder first, then the blazer, then folded the wet towel into a neat square. A man pushing a janitor's cart at the far end of the corridor saw the whole thing. He was older, 60-some, broad in the shoulders, with the slow patience of someone who has cleaned up after frightened people his whole life. He set the brake on his cart and came over and, without a word, took a pair of reading glasses from his shirt pocket, folded them once, and held them out. They were a woman's glasses, gold at the temples, the lenses faintly scratched. "For the fine print," he said. "My wife couldn't read a thing without 'em. She's been gone 2 years. I keep meaning to give 'em to somebody who reads as much as she did." He nodded at the folder. "You look like a reader." Nya took the glasses. In the corner of the case, in ballpoint gone almost white, someone had written a name. The custodian's name was Lemuel Pratt. He had been an army medic in a war the country liked to forget, and he had pushed a cart down those halls for 22 years, and he had handed out more small mercies than anyone in that building would ever count. He nodded once and pushed his cart on. That night, in the kitchen on Cobalt Street, Odessa told Nia a story she had heard pieces of and never the whole. In 1956, Odessa said, "Your great-granddaddy Amos sat across a table from 3 men from the coal company in a room not much bigger than this kitchen. He'd been coughing black for 2 years. The company doctor wrote him up healthy, said his lungs were fine, said the dust didn't do what every man in that hollow knew it did. They had a paper said so, signed by a doctor, and that paper meant they didn't owe him a dime." She unfolded the yellowed clipping from the Bible, smoothed it flat. The photograph showed a thin man at a bare table, collar frayed, jaw set. Amos couldn't afford a lawyer, so he was his own. 3 days he sat there, 3 days. And on the 3rd day, he laid that company doctor's own appointment book on the table and showed them. The doctor never examined him at all the day he was supposed to be in that office. He was 3 counties over at a horse race. The exam never happened. The paper was a lie. They paid every miner in that hollow inside a year. Odessa pressed the brass mining tag into Nia's palm. It was warm from her hand. Amos's check number. They give every man a brass tag with his number on it so they'd know which body was whose if the roof came down. He kept it his whole life to remember what they thought he was worth. She closed Nia's fingers around it. "You take that Thursday." Nia looked at the clipping a long time. She looked at the thin man's frayed collar. Then she got up, walked to her room, and opened a notebook, and on the first page she wrote, in pencil, "They told my grandmother she could live without a heart. Thursday they'll find out I can read." Then she rode 40 minutes across town, in the dark to the side door Verna Loomis had told her about. The next 48 hours were the hardest of Nia Brevard's young life. Verna Loomis met her in a basement records room that smelled of toner and old paper, and what Verna Loomis had been keeping in a drawer for 3 years was not a chart. It was a binder, 211 denials. Cardiac, oncology, dialysis. Every one of them stamped with the name of a physician reviewer. Every one of them she'd quietly flagged because the math was wrong, because the same handful of reviewer names appeared on hundreds of denials in a single day, more reviews than a human being could do if he never slept. She'd never had a reason a grandmother could understand. She had a notebook of small wrongs and no one to deliver it to. "They get a bonus," Verna said very quietly, turning pages. "The administrators. Stonebridge runs what they call a value-based contract. The fewer dollars they spend on care, the bigger the check. Ballard's bonus is tied to it. They don't call it denying people. They call it medical loss ratio." She put her finger on Amsis Heald's name, which appeared on 43 denials. "This man. I went to his funeral. My cousin nursed him at the end." She looked up. He couldn't review a grocery list the last year of his life. Nia worked through both nights. She pulled the death certificate from the State Vital Records Office, certified. A dead man's date, stamped above a denial 5 months younger than his grave. She pulled the publication history of the clinical criteria the denial cited Stonebridge Cardiac Necessity Criteria, Revision 9, and found, in the company's own public archive, that Revision 9 did not exist on the day Odessa was denied. It was published 11 months later. They had denied her grandmother's valve using a rule they had not yet written. 2 impossibilities stacked. A reviewer who was dead and a standard that hadn't been born. She found Dr. Bridget Tomczak, too. Odessa's cardiologist had abruptly stopped returning calls a week after the denial. Nia sat on the curb outside the cardiology clinic until the lights went off at 7, and when Tomczak came out and saw her there, the doctor's face did something complicated and tired. "You shouldn't be waiting for me," Tomczak said. "I just need to know one thing," Nia said, off the record. "Did they pressure you to stop pushing for the surgery?" Tomczak looked up and down the empty street. "They didn't pressure me," she said. "They told me my referral numbers were being reviewed. Said my approval rate was an outlier. In this system, that's the same thing as a threat. I have a daughter starting college." She started to walk past. Then she stopped and turned back and her voice was steady. "But you write it up and you send it to me, and I will sign it under oath. Every word. I have wanted to sign something true for 2 years." She put a card in Nia's hand, her cell number on the back. "They tried to make me small," she said. "Don't let them do it to you." By Wednesday night, Nia had a certified death certificate, a printout of the criteria's publication date stamped by the company's own server, a sworn affidavit from a cardiologist, and Verna Loomis's binder of 211. She had everything she needed to end it before it started. She could have walked into Driscoll's office Thursday morning and laid the death certificate on his desk and demanded the whole thing be dismissed in 5 minutes. She chose not to. She sat at her great-grandfather's table and wrote one line in the notebook. Let him swear to it first. The ones who fall the hardest are the ones who climbed up to brag. Then she folded Lemuel Pratt's wife's reading glasses into her bag, slid Amos's brass tag into the breast pocket of the dried-out blazer, and turned off the light. Thursday's hearing was held in the big conference room with the cardiac wings donor names etched in glass. Driscoll opened it the way he'd ended the last one, talking past Naya to the rest of the table. The board, he said, had reviewed the grievance and found it without clinical merit. He moved to close the matter. Dr. Ballard, in the tone a man uses when he's already won, said he'd like to put a few things on the record first for completeness. Of course, Driscoll said. Ballard turned to face the room. He was good at this. 31 years of standing at the heads of beds telling families bad news had given him a voice that filled a space without rising. I want to be clear, he said, because there's been some implication, some innuendo, that our review process is not what it should be. Every adverse determination at this institution is reviewed by a licensed, board-certified physician who examines the complete clinical record. There are no exceptions. I stake my license on it. The determination in Ms. Brevard's grandmother's case was made properly by a qualified physician, according to established clinical criteria. I'd ask the board to note that for the record and close the matter. Across the table, Verna Loomis, who had asked to attend in her official capacity, looked down at her hands. Behind Na in her robin's egg dress, Odessa held the corner of her sweater. Na stood up. She had to set her hands flat on the table to keep them still. Chairman Driscoll, she said, with the board's permission, I have a short presentation. The record requires it. If at the end of it the board is unmoved, I'll sit down and you can close the matter. Driscoll waved a hand, generous in his certainty. By all means, we have about 10 minutes before the next item. He smiled. Past your bedtime yet, Miss Brevard? A laugh started at the administrator's end of the table and died fast because Nia had already put the reading glasses on, and there was something in the way she did it, the deliberateness of it, that made the room go quiet. Dr. Ballard, she said, you stated just now on the record that every denial is reviewed by a licensed physician who examines the complete record. No exceptions. You staked your license on it. Is that still your testimony? Ballard leaned back. It is my testimony, and it's a fact. Yes, and the physician who reviewed my grandmother's case is named in the denial letter your own company sent. Dr. Ambrose Heald. Do you stand behind his review? I stand behind our entire process, Ballard said with a small irritated smile for the room. Dr. Heald is one of our contracted reviewers, a respected physician. Yes. Nya gave it 3 seconds. She had practiced the 3 seconds. I'd like to enter into the record grievance Exhibit 1. She slid a certified document down the long table, a death certificate from the Ohio Department of Health, in the name of Dr. Ambrose Heald. Mrs. Loomis, you handle records. Would you read the date of death aloud for the record? Verna Loomis took the page. She read it slowly, the way an old archivist reads anything that matters. She read the date. Then, because she could not help it, she added, that is 5 months before the date on the denial letter. The room did not erupt. It did something quieter and worse. It held its breath. At the far end of the table, the young administrator with the tablet stopped typing. Ballard's smile stayed on his face a half-second too long, the way a light stays on in a window after the house has gone dark. There's obviously an administrative error in the, he started. I'm not finished, Nia said, and she did not raise her voice, but it carried. Grievance Exhibit 2. Another page down the table, a printout from Stonebridge Health Partners' own document server, certified by timestamp, showing the publication date of the Stonebridge Cardiac Necessity Criteria, Revision 9, the clinical standard your denial cites by name. Mrs. Loomis, the publication date, please. Verna read it. The criteria they had used to deny Odessa Brevard's heart had been published 11 months after they used it. Driscoll had stopped smiling somewhere in the last 30 seconds. He leaned forward now. You're representing to this board, he said slowly, that the denial cited a rule that did not exist and was signed by a physician who was deceased. I'm representing the public record, Nia said. A dead man cannot review a chart. A rule cannot be applied before it is written. Both of those things are in your own documents. I only read them. Ballard's hand drifted towards the cuff of his expensive shirt and worried the button there once, twice. These reviews are conducted under a contracted physician's panel, he said. If a name was attached in error, that is a clerical. You said no exceptions. Naya turned slightly toward him, the reading glasses catching the light. Less than 15 minutes ago, on this record, you staked your license on the claim that every denial is reviewed by a living, licensed physician examining the full record. Would you like to amend that now, Dr. Ballard, or after the State Medical Board reads this transcript? Ballard opened his mouth. Nothing came out the first time. I rely on the information my staff provides, he said finally. That is not what you said 2 minutes ago. Nia let a beat pass, the way she'd rehearsed it, into the dark 38 times. Shall I ask the recorder to read your statement back? He did not answer. His hand had found the shirt button and it would not stop. She did not give him room to breathe. Grievance Exhibit 3. A sworn affidavit under penalty of perjury from Dr. Bridget Tomsack, board-certified cardiologist, my grandmother's treating physician. It states that she twice documented this procedure as medically necessary, and that after the denial she was warned. Her referral patterns were being audited, a warning she understood, in this system, as a threat. The affidavit attaches dated internal communications, referencing exactly the kind of cost savings targets that make denying a valve worth more to this institution than approving one. She laid the affidavit on the table in front of Driscoll, and Grievance Exhibit 4. She set Verna Loomis's binder down. It made a heavy sound. 211 denials, Nia said. Cardiac, oncology, dialysis. Compiled over 3 years by a member of your own record staff. The same handful of reviewer names appear on volumes of reviews no human being could perform in the hours available, some of them, like Dr. Healed, on dates after they had died. I am not asking the board to take my word for any of it. Every page cites a document already in your possession. Bridget Tomjack's affidavit, Nia did not need to say, was the smallest piece of it. The binder was the building falling. Ballard stood up. His chair scraped. This is an ambush, he said, and his voice came out wrong on the last word, cracked in the middle like a boy's. A bead of sweat ran from his temple to his collar and bloomed there. I won't sit here and be lectured by a what, Dr. Ballard? Nia said, quietly. The room waited for the word with him. He did not say it. He looked at the death certificate and at the binder, and at the faces around the table that would not meet his eyes, and the words stayed behind his teeth. At the far end, both Stonebridge representatives were quietly closing their laptops. One of them was already typing something under the table, a thumb moving fast. He was texting the Home Office. In the back of the room, a local health reporter named Dana Pell, who had come expecting a routine grievance and a free parking validation, drew a hard line through her notes and started a fresh page, and at the top of it she wrote 3 words she would not be able to print. Ballard lowered himself back into his chair. His hands shook too badly to gather his papers. Nia turned, slowly, to Howell Driscoll. She took the reading glasses off. She did not lift onto the balls of her feet, did not make herself small or large. She stood the way her great-grandfather stood in a photograph from 1956, flat and square and done apologizing. The denial of my grandmother's procedure rests on a review by a man who had been dead 5 months, and to clinical standard that would not exist for almost a year, certified to this board. Under oath by your chief medical officer, who staked his license on it. I move that this grievance be sustained, that my grandmother's procedure be authorized today, and that this institution's entire utilization review record, under the Stonebridge contract, be referred to the State Medical Board, the Department of Insurance, and the United States Attorney for the Northern District of Ohio for review of fraud. In the breast pocket of her dried-out blazer, Amos Brevard's brass tag sat warm against her ribs. Howell Driscoll did not speak for a long time. He looked at the death certificate. He looked at the binder. He looked at Roland Ballard, who could not look back, and then he looked, finally, at the young woman in the second-hand blazer who had walked her own grandmother in by the elbow. He did something he had not done in 11 years of chairing that board. He stood up. The grievance is sustained, he said. His voice had gone quiet. Mrs. Brevard's procedure is authorized, effective immediately, top of the schedule. He paused, and when he went on, he was not speaking to Nia anymore, but to the whole room, to the reporter and the administrators, and the 2 men from Stonebridge gathering their things. This board will refer the matter as requested. All of it. He turned to Nia, and something in his face had aged 10 years and 10 minutes. Monsieur Brevard, I pronounced your name wrong 3 times last week. I knew how to say it. I owe you an apology. And this institution owes you a great deal more than that. Odessa Brevard rose from her wheelchair without help, which she was not supposed to do, and crossed the room slow and steady in her robin's egg dress, and laid her hand against her granddaughter's cheek the way she had the morning. She brought her home with nothing but a diaper bag. Naya, who had not let her voice break through 2 hearings and 48 sleepless hours, let it break now. "Grandma," she said, "you're getting your heart fixed." Odessa didn't answer with words. She reached into the breast pocket of the blazer, took out Amos's brass tag, kissed it once, and folded it back into her granddaughter's palm. What followed was not a defeat for Roland Ballard. It was an unmaking. Within 48 hours, Stonebridge Health Partners suspended the value-based contract and announced an internal review, which is what companies say when the federal review has already started without them. Within a week, Calderwood Regional placed Ballard on administrative leave, then accepted his resignation, then scraped his name off the door of the office and the masthead of the foundation. Within a month, the state medical board suspended his license. The disbarment of doctors moves slower than the disbarment of lawyers, but it moves. And 3 months after that, at a formal hearing, they took it for good. The U.S. Attorney's Office opened a healthcare fraud investigation that reached past Ballard to the executives at Stonebridge, who designed the bonus structure, including a chief executive named Royce Vandermeer, who had given a keynote that spring on compassionate efficiency. Vandermeer was indicted before the leaves turn. Howell Driscoll did not survive the cleanup either, and he did not try to. He resigned from the board the same week the federal subpoenas arrived, and on his way out, he did one quiet thing. He hand-delivered Verna Loomis's binder, all 211 pages, to the regulators himself, and told them she'd kept it at risk to her job for 3 years, and deserved to be the reason it mattered. Verna Loomis, 31 years in a basement, was named the hospital's first director of records integrity within the month. The drawer beside her desk didn't need to hold a private notebook anymore. Bridget Tomsack's referral numbers were never audited again. She testified to the federal grand jury, and afterward she took on, free of charge, the case of an elderly man in the next county, whose dialysis had been denied by a reviewer who turned out to be on a cruise the week he supposedly read the chart. She won. Lemuel Pratt kept pushing his cart down the same halls. When a reporter from the city paper tracked him down to ask about the glasses, he said he didn't know what she was talking about. And then he said his wife would have liked the girl, and then he went back to work. Odessa Brevard got her valve on a Tuesday. She was home in 3 days, sitting on the porch Amos built, complaining that the cocoa was too hot. As for Naya, the letters started inside a week. Cleveland Clinic, the Mayo Clinic's audit division, 2 law schools that had read Dana Pell's front-page story and wanted to fast-track a girl who could read a fraud out of a document the way other people read a menu. A foundation offered to pay for any degree she wanted, anywhere. She answered most of them politely. She turned most of them down. She took a job instead 3 towns over, building the patient advocacy program at a small county hospital that still had a quilt in the lobby, because somebody had to read the fine print for the people who couldn't, and she knew exactly what it cost them when nobody did. In the kitchen on Cobalt Street, a new frame went up on the wall above the toaster. It held the front page of the Merrifield Ledger. The headline read, "Transport Aide ends a 30-year career in 10 minutes." It hung beside 2 others. The first was the yellowed clipping from 1956, a thin man in a frayed collar at a bare table, who fought a company doctor's lie and won. The second was a photograph of a man in a hospital orderly's uniform, Odessa's late husband, who pushed beds at Calderwood for 29 years and was passed over for every promotion he ever earned, and never once raised his voice about it. The third was the front page with his great-granddaughter's name on it. 3 generations. 3 rooms, 3 times a family was handed a piece of paper that said they were worth less than they were, and 3 times somebody refused to sign it. There is a young woman somewhere right now, in a blazer she pressed on a wobbling board, walking into a building that has already decided what she is, carrying a folder nobody thinks to be afraid of. There is an old man pushing a cart down a hallway who notices the one person nobody else notices and reaches into his pocket. There is a clerk in a basement with a binder she keeps in a drawer, watching small lies pile up year after year. waiting for one good reason and one honest person to finally hand it to. They are everywhere, those three. The world is built and quietly saved by people it is agreed not to see. Real ability doesn't disappear because a room refuses to look at it. It just waits, patient as a brass tag in a closed fist, for the room to grow up enough to hear it. If this story moved you even a little, do one small thing. Tap the like button, it's free. And it tells the platform that stories about the overlooked deserve to be seen. Share it with someone who's been told they're too young, too poor, too quiet, or too anything to take up the space they were standing in. And subscribe to Lore Stories, because next week there's another room that didn't see it coming, and another person walking in who reads more than anybody gave them credit for.